Medicare and when it's time to review plans to ensure you're on the best plan. Kimberly Reynolds is with the Welch Group, and she is here this morning to talk about that. Good morning.
Hey, good morning.
All right, so what do people need to know? And I know a lot of people who may not be near that may be thinking, well, why am I worried about it? But you do need to kind of think about it ahead of time, right?
You do, and actually today's the big day, so open enrollment starts today.
Okay.
And if you're in Medicare age, your mailbox has been filled with just tons of mail, and you're like, where do I start?
Okay, explain why, when you get to Medicare age, why are there so many decisions?
Okay, so there's two main options. So you really need to decide, okay, do I want to stick with original Medicare? And this is best for people that if you have some health issues or if you want to go to any doctor as long as they accept Medicare, then the original Medicare is the best option because you're not stuck to a doctor's network. Now you do have medical and your prescription plan is separate, so you have to do a little bit more research to make sure you have the best two plans.
And is that the one where people fall into the gap where it'll pay for things for a while and then it won't?
So the prescription plan, basically you have 3 different levels where you have the beginning level where you have less copays and you fall into a little donut hole, and then you fall into the catastrophic coverage part. So
okay, so what do people need to know today? How can we help them?
Yeah, so I think you need to decide, you go with the original Medicare or you go with an Advantage plan. Now an Advantage plan is nice because it combines your medical and your prescription in one.
Okay.
That's best if you're really healthy and you're okay with sticking with a certain doctor's network.
Okay.
If you go with original Medicare, that's best if you have some health issues, you want to set premium every month, so really little out-of-pocket costs when you go have services done. But you really need to review your prescription plan because what happens is every year they change what prescriptions they cover.
So what you're taking could not be covered?
Yeah, so if you're on a prescription plan, next year that same plan may not cover the prescription you're taking, so you have to check.
I remember when my mom had to make a decision on Part B or D or whatever, and her pharmacist would actually talk with her and show her which ones. How do you find out? Is that a way to do it?
Yeah, so a lot of pharmacies will help, and I always encourage people, try to find somebody that will help you that can look at all of the plans and say, okay, based on your situation, this is the best plan, because there's just a lot of information and you just want to make sure that you're on the best plan that covers your needs, and then from a cost perspective that's the least cost for you.
So you just tell people what your situation is, where you are, and what you're more comfortable with, and then you can pick one of these. And so open enrollment is today
and you have
till
to,
December the 7th.
Yeah, December 7th. So I would encourage, Medicare.gov is a great resource to use. It combines all the plans in one so you can review everything. But there's a new website this year, so you need to make sure you go to Medicare.gov and explore that and start looking today so you can pick the best plan.
Medicare.gov. Kimberly Reynolds from the Welch Group, thank you so much. We all get there at some point in time.
That's right.
So good advice.
All right, thank you.
Good to see you. All right, still ahead, 7:40.